Hello, I'm Dr. Ninglan Wang. I work with WHO Health Emergency Program, Border Health Team. As we have already learned in Module 2, WHO has released a practical guide for UN country teams, the operational planning guidelines to support country preparedness. This guide is intended to provide immediate support to governments and partners in implementing their COVID-19 country plans. This will be operational from now until April 30th. The country guidelines are structured along 8 key pillars of public health response. Pillars are operationalized by actions to be taken to enhance country preparedness. The focus today is Pillar 4, points of entry. With this video, we will describe the actions to be taken within this pillar. This is relevant at country or sub-country level for governments, UN country teams, and partners. The goal is that after watching this video, you will be able to conduct your own assessment using the WHO online planning tool for COVID-19. In Module 2, we presented the high-level actions and recommendations of Pillar 4, emphasizing the importance of efforts and resources to support early detection and management of air travelers and risk communication activities at points of entry, including convenience. Let's now take a deeper look at the practices. There will be 3 levels of preparedness at points of entry. At first level, develop and implement a public health emergency plan at points of entry in a multi-sectoral approach. The IHR defined points of entry as a passage for international entry or exit of travelers, baggage, cargo, containers, conveniences, goods, and post parcels, as well as agencies and areas providing service to them on entry or exit. A points of entry is an integral part of its surveillance and response systems and helps support public health functions in the country. This is frequently associated with early detection and management of possible cases at points of entry or on conveniences. The international health regulations define minimum routine capacities at points of entry related to water and food safety, waste management, vector surveillance, etc. The IHR also requires that POE should establish core capacities for responding to public health events, including establishing and maintaining a public health emergency contingency plan with clearly defined roles and responsibilities of all stakeholders involved in emergency response at points of entry, including conveniences. WHO Guide provides a recommended approach, structure, and logical set of considerations for the countries and POE health authorities to develop a plan in a multi-sectoral approach. It is important to ensure alignment of POE health emergency plans with POE overarching emergency plans. You must also align the POE health emergency plan with the National Public Health and Emergency Response Framework. WHO has published several technical guides to ensure timely event management, including event identification, verification, risk assessment, and response at points of entry or on board of conveniences. Establishment of effective mechanisms for multi-agency coordination and information sharing between public health authorities, POE stakeholders, including operators of ports, airports, ships, and aircraft, and the national IHR focal point are of importance to ensure coherence of response at all levels. At second level, preparedness includes timely dissemination of the latest disease information, standard operating procedures, equipment, and trained staff for management of public health events at points of entry and on-board conveniences in a risk-based approach. It is essential for points of entry health authorities to form a link with the national surveillance and response systems, for points of entry to share public health information and receive recommendation from the national level and from WHO. In addition, procedures, staff, supplies, and facilities should be put in place to interview suspect or affected persons, assess and care for affected travelers by establishing arrangements with local medical facilities for their isolation, treatment, and other support, and apply recommended measures to disinfect, direct, disinfect, decontaminate, or otherwise treat baggage, cargo, containers, conveyances, etc. Coming from or going to affected areas. It can be targeted for risk communication, for example, on how to protect themselves and the POE conveyance employees from exposure and to encourage self-reporting appropriately. Information to travelers should be developed to raise their awareness on how to protect themselves and report in case of possible exposure and symptoms. This information should be contextualized to the population targeted and updated regularly. Third-level actions. When points of entry preparedness is sustained, take account of regularly monitoring and evaluation of the effectiveness of these actions and adjustment of the plans as appropriate. Points of entry should define key performance indicators and ensure data collection and analysis to monitor regularly the quality of readiness and response activities and adjust as needed. Now that you have watched this video, you should be able to describe each key action at points of entry and be ready to assess whether each has already been done and needs to be implemented at the country or sub-country level. It is very important to keep in mind that the actions presented in this video are a guide and should not supersede existing national guidance and plans. It should be used to rapidly adapt existing relevant national actions and accelerate preparedness. For more information, you may access the operational planning guidelines in the additional resources section of the training platform. You are now ready to begin the assessment using the WHO online planning tool for COVID-19. Thank you for watching this video.